Fecal incontinence is very common in women, but it can happen in men as well. It is the loss of being able to control bowel movements. It can range from minimal leakage to having a complete bowel movement without even realizing it. There are a lot of things that can be adjusted in one's diet, as well as medications and fiber supplementation that can help most people with their complaints. There are other patients who may need other investigations or interventions to help them. It's very common in women who have had episiotomies many years ago when they had children. It is also common in other patients who have had other anorectal conditions requiring intervention. We are able to provide sacral nerve stimulation here. That involves placing a stimulator much like a pacemaker that enhances a patient's ability to feel when they need to have a bowel movement and gives them the opportunity to go to the restroom without having an accident. Anyone who's had any anorectal surgery or an episiotomy can often have some damage done to the muscle. That damage doesn't necessarily cause a problem right away, and over time, especially as women age and they have less estrogen, the tissue becomes less taut and weaker, and patients can develop fecal incontinence later in life. The standard of care now for fecal incontinence is sacral nerve stimulators, and it is the most successful device that we have available to return people back to an active lifestyle. For most of our fecal incontinence patients, we work with them on diet, we work with them on medications, as well as fiber to bulk up their stool. Also, some patients will benefit from doing biofeedback training with a pelvic floor therapist. And those patients who don't see the results that they want in those interventions, and we would offer them sacral nerve stimulation. That is an outpatient procedure. It usually is a two-stage procedure. The first stage is a test. It's a wire is placed through the skin and right next to the nerve that controls the sensation to the rectum. The procedure is done as an outpatient, and it's a test for approximately 2 weeks while the patient records how their bowel function changes during that time period. If a patient experiences a greater than 50% improvement in their symptoms, then we know that it is likely that they will have an increased quality of improvement in their life. And therefore we do a second stage outpatient procedure where we put the generator into the skin underneath, and the patients are monitored after that.